These are in listen-only mode.
Welcome to our webinar today. My name is Bill Baker, and we're delighted to have you with us today. This is part of the Crisis Coach webinar series that is presented by the New Jersey MEP and Firestorm. This is number 7 in the series. Today we're discussing Where'd Everyone Go? Managing Communicable Illness and Other Employee Absences. Firestorm likes to have you as friends. You can become our friend on Facebook, Firestorm Solutions. Please follow us on Twitter, Firestorm Soul. The hashtag for this session is Crisis Coach. Firestorm transforms crisis into value and empowers you to manage risk and crises. Firestorm expertise is crisis management, critical decision support, crisis communications, crisis public relations, and consequence management. We do want to remind you the presentation today is not complete without the accompanying oral comments and discussion, and this information should be discussed in conjunction with advice from your organization's personal counsel. This information should not be considered or interpreted as legal advice or legal opinion. We're delighted to have this series underwritten by our very, very good friends at the New Jersey MEP, and if you want to go to previous webinars, you can go to firestorm.com, and you can watch past webinars in this series, and you can register for future webinars. We do have Joe Caratanudo with us today. He's with the New Jersey MEP. Joe, over to you, please.
Thanks. Yes, for those that aren't familiar, New Jersey Manufacturing Extension Program, its focus is really on helping companies, specifically small to mid-sized manufacturers, become more productive, more efficient, more globally competitive in what they do. And we do it through a host of different services that we provide, everything from energy management to helping companies take advantage of R&D tax credits. We also do a lot in the process improvement arena, in terms of things like Lean and Six Sigma, but we also assist companies on the strategic end with things like business planning and strategic planning, ISO certification, which many companies are moving to now to upgrade to the new 2015 standard, which also has risk assessment as part of it and obviously integrates into BCP plans, which brings us to what one of the topics we're talking about today. So back to you, Bill.
Thank you, Joe. We also have in your area, Blair Neville. Do we have a picture for Blair here?
I do not, Bill.
Yeah.
Okay.
Bill, that's a good thing. That's a good way to start the presentation. They don't want to be looking at me this early in the day. But for those of you who've been on presentations, our presentations before, you've heard my name. For those not, I'm Blair Neville. I am the Firestorm Principal up here in the New Jersey area. And again, I want to thank Joe and the MEP for their support of this whole idea of preparedness and business continuity. They've been a great partner of ours, and it's a real pleasure to work with them, but it's also important to know that they are very serious about driving this message of preparedness to all of their clients and all the manufacturers in New Jersey. And today, this idea of communicable illness and absenteeism and how it can affect the business is important, especially with obviously the ZIKA issue growing and becoming a little more of a concern and awareness. This is a great opportunity to get ahead of that. So again, thanks for their support, and Ken, thanks for putting this together for us.
Thank you, Blair. Our presenter today is Ken Mercer. Ken is a pharmacist. He's a graduate of the University of West Virginia, or I guess it's actually West Virginia University. And he has been a pharmacist for most of his career, the last 29 years or so, working with hospitals, with senior living centers. He's had a business of his own as well. He is an expert in medical conditions and how to take care of medical conditions, so he's a good person to talk about communicable illness and its impact on employee absence. So we would like to turn the time over to our very good friend and our colleague, Ken Mercer. Ken, over to you, please.
Thank you very much, Bill. Good day. I'd like to thank everybody for taking the time to join us today. I'm delighted to have this opportunity to talk to you about communicable illness today and the crisis that might represent to a business should you see it. I'm a pharmacist, so I come to this topic from a healthcare background. I'm a business owner and I'm a manager. So I understand the implications of employee absenteeism. I'm going to try to give you some things to think about today when managing or preparing to manage a communicable illness crisis where a significant amount of your workforce might not be available to you. Lastly, I'm going to offer some help in reviewing your communicable illness plan or in helping you write one of your own. I guess that is a service that Firestorm will be offering. So I want to start out by apologizing in advance if you hear Stella and Lorenzo in the background, my two dogs. Sometimes don't hear me that well when I give my instruction, be quiet during my presentation, as I am in my home office today. So a crisis is any situation where your ability to run your business is impaired. Sometimes crises are the result of external forces and sometimes internal forces, but the idea that is consistent with any and all crises is that if you have thought about the crisis in advance and you've done some preparation work for the crisis in advance, your chances of managing through that crisis is improved, and the outcome for your business is usually better. I had I remember an 8th grade history teacher who used to say, preparation is the key to success. The heart of a communicable illness plan is to ensure that you have a healthy workforce so that your business can continue to run no matter what. Have you thought about your tolerance for absenteeism? Have you thought about at what point absenteeism would harm your business? I'm speaking to manufacturing groups today. I would think that you are particularly sensitive to an outbreak of absenteeism, if you will. You need bodies in place on a line to produce products and services that you are selling. Without those bodies there, are you able to function? So that's a communicable illness plan is all really based around that, keeping your people in place so that they can continue to work. As we go today, I'd also like you to think about how you might monitor for an outbreak of absenteeism so that you can intervene before your business suffers. Do you have a mechanism of monitoring and knowing what your employees are talking about, what they're afraid of? Do you know what they're thinking? I assure you that they are thinking much different things than they are reporting to you as a formal boss-employee relationship. So what is a communicable illness? It is a disease whose causative agent may be passed or carried from one person to another. That passage is done in one of three ways, directly or indirectly. A direct mode of passage from one individual to another is an exchange of bodily fluids. It could be a discharge from an open wound. It could be inhaling droplets from a cough of a tuberculosis patient. An indirect transmission would be a passage of the vector from a person to an inanimate object, like a doorknob, a toilet seat, a drinking glass. If you drink after someone who has the flu, you might well get the flu. And the third way communicable illnesses are passed are via vectors, varmints. Flies, mosquitoes, rats are all capable of spreading disease. A pandemic will pose a catastrophic risk to human resource staffs. Again, if you are a business who needs bodies in place to do work, you are susceptible to this. Another kind of business, like a legal firm or an accounting firm, for example, may not be as susceptible to this kind of crisis. If they can work from home, you may not even have to come to the office. So work still might be able to proceed without even coming to work, coming to an office. So we're really talking today about for those businesses who a large absenteeism rate would have a detrimental impact. History has taught us that during a pandemic, as much as 40% of your workforce might not be available. 40% is a pretty big number. That time, that length of time that the absence continues might be a year and a half to 2 years. Very long periods of time would obviously stress any communicable illness plan that you have in place. The Spanish influenza of 1918 resulted in 500,000 American deaths. The Asian flu of 1957 resulted in 70,000 American deaths. Just a couple of years ago, the H1N1 swine flu virus caused hospitalization of almost 100,000 Americans. The AIDS epidemic, the CDC estimates that about 1.2 million Americans have the HIV infection today, and to date, about 650,000 Americans have died from that disease. The Zika virus is going to be a little bit different. As we talk about in a few upcoming slides, few people are going to die from a Zika infection. Some people won't even know that they're sick. However, the absenteeism rate might be very similar to these, but it will be because of fear, not due to illness that you can't come to work. Folks are going to be afraid to come to work. Communicable illness planning requires a thorough examination of your HR practices and policies. Do those practices and policies cover a long-term absence? Do those practices and policies cover screening, monitoring, leave, leave with pay, leave without pay? There are many HR kinds of things to consider. You have to keep in mind all of your regulations. You've got state, federal, and local regulations, and understand that clearly these kinds of absenteeism rates will require embracement, if you will, by senior management. Again, do you have a way of screening people and kind of knowing what they're thinking about, gathering intelligence. Fear is what we are likely to see with the Zika virus. Do your policies cover absenteeism due to fear? Some of you might have an employee assistance program. Perhaps they can be brought in to help educate, help keep people at work. Fear is best conquered with accurate and direct communication and education. Educating people as to what to be afraid of and what not to be afraid of is very important. And the earlier the better that you engage in this, the better typically you are. There will be a brief available after this webinar in probably just a couple of days. In that brief, there will be a one-page Zika document that is written by the CDC. I saw it and realized it's a really good example of a simple and direct communication that can be used for all employees. It's just a one-page piece of paper, can be posted on bulletin boards, can be put in mailboxes. Tells employees how to protect themselves against Zika. So the rest of the day, I want to talk about Zika, and I want to keep in mind that we're really talking about a disease that is inciting fear. And will fear keep your workforce from coming to work? Because that can be corrected if done so early. Zika is spread to people through mosquito bites and during unprotected sex. Most common symptoms of Zika are fever, rash, joint pain, and conjunctivitis, red eyes. Nothing sounds real serious, right? You probably don't die from any of these things. The illness, the Zika illness, is generally mild, symptoms lasting from several days to a week. A severe disease rarely requires hospitalization. However, the scary part about Zika, and the reason it is in the news and people are talking about it and thinking about it, is that it's linked to microcephaly. That's a serious birth defect where the virus is passed from pregnant woman to fetus during pregnancy, and the baby is born with a smaller brain. That will lead to developmental delays and a lifelong complications that the family and the baby will deal with. That's the scary part. Mosquitoes have been called the deadliest animals in the world because of the diseases they spread. A female mosquito infected with Zika will continue to bite people and spread its disease over its lifespan of about 30 days. There are 176 species of mosquitoes identified in the United States. 2 of those species are known to carry the Zika virus at this time. And just for historical reference, the Zika virus was first discovered in 1947 in an area of Uganda. So how does Zika spread? It is spread by mosquitoes that are aggressive daytime biters. Not so much at night. Protecting yourself against daytime mosquito bites becomes the most important thing that you can do. A mosquito becomes infected with Zika when it bites a person who is infected with Zika. So the victim, the individual, will give the virus to the mosquito who bites him, and then that mosquito will move on to the next person and infect the next person. It's also spread during sex with an infected male There has been one case reported of passage from a female during sex, but primarily we are talking about sex with an infected male. The virus is passed to the fetus from the pregnant woman during pregnancy or around the time of birth, and it might be transmitted through blood transfusions, but that is not known at this time. Again, daytime protection against mosquito bites becomes the most important thing that you can do. So where is the Zika virus? This is a photo of the Western Hemisphere. The purple areas represent where Zika is active. We see it's a Central and South American thing, the Caribbean. These are some pretty good vacation spots that people like to go to. You also might be aware of a relatively major sporting event that's going to happen in the center here in Brazil called the Olympics. You've probably read, seen, heard of athletes choosing not to go to this perhaps one-in-a-lifetime sporting event that they're electing not to go to for fear of Zika. NBC is also reporting that some of their staff are not wishing to go to Zika to cover the Olympics. Even though August is not high mosquito season in Rio de Janeiro, the fear still is there. The media coverage has a way of fanning the flames of fear. You might see or hear of fellow employees who are afraid to come to work if it is known that others, their colleagues, have traveled to these areas. Again, these are the Caribbean, highly desirable vacation destinations. The emotion of fear will develop legs of its own, and it's self-sustaining. It's a snowball rolling down a hill that, if corrected early, if caught early, you can stop the snowball. Once it gets big enough that it can't be stopped, you're behind. The correction of that emotion of fear must be done early through effective education. Even the Catholic Church is struggling with their contraception position in certain parts of the world. Should women avoid pregnancy in these areas? That is being talked about. The CDC is working on a clear statement regarding the time to avoid pregnancy after travel to one of these high-risk areas. Again, that statement has not come out yet, but the CDC is working on it. All of these things fan the flames of fear. So the United States, these are cases documented within the continental United States, and Puerto Rico. Almost all of these cases have been determined to be related to travel. When somebody goes to one of these hot areas and catches Zika there. About 1,300 cases of Zika have been documented in the continental United States. And actually, we've had the first Zika-related death in the continental United States. It occurred the end of June in Utah. It is unknown how Zika contributed to this patient's death, but it is known that he had the Zika virus at the time of his death. He had other complicating factors as well, so it is not known how Zika contributed to this patient's death. And then just Monday, just 2 days ago, we had a report of a transmission of Zika that did not occur via travel nor sex. It also occurred in Utah, and it was a caregiver of a patient in Utah. This patient had an extremely high titer of the virus in his blood. It is not known how that patient acquired Zika because he didn't have sex and there were no mosquito bites in Utah. So it is not known how this this new patient acquired Zika from the old patient, but so there's still a lot unknown about this disease. So where are these mosquitoes? There are two species of mosquitoes of the 176 that are in the United States. The two that are known to carry the Zika virus are the excuse me, the Aedes aegypti and the Aedes albopicus. Those are the graphs showing the range of those two mosquito viruses. You can see that this is primarily a southern phenomenon, although does extend into the Northeast. New Jersey is within the range of both of these mosquito species. Who is at risk for Zika? This is the part that makes people worry. Zika infection during pregnancy has been linked to the fetus being developed with a birth defect known as microcephaly. This birth defect, a smaller than normal brain, will result in lifelong developmental delays for this child. There have been a few isolated reports of other problems associated with Zika, some hearing deficits, some eye deficits, and a few cases of Guillain-Barré syndrome. But primarily it is this microcephaly that people are worried about. I have 3 kids and I have 2 grandkids. All the parents in the room will know that that we tend to do almost anything we can to protect our children. What do you do if you have Zika? You get plenty of rest. You drink fluids to prevent dehydration. One of the symptoms of the disease is fever, which leads to dehydration, so drinking fluids prevents that. Medications to reduce fever, such as acetaminophen, which is Tylenol, or ibuprofen, which is Motrin or Advil. And then lastly, you ought to prevent yourself from getting bitten by additional mosquitoes. Again, what you are doing is not eliminating Zika yourself because you've already got it. There are no medications, no vaccines against it. But if you have Zika and you give it to the next mosquito who gives it to the next person, you are helping propel the disease forward. So you staying out of the way of mosquitoes is a really good, responsible thing to do. So how do you prevent Zika? Again, no vaccine, no medication. The best way to prevent the disease is to protect yourself from mosquito bites. You wear long sleeve shirts, long pants, stay indoors with air conditioning, window screens to keep mosquitoes outside. And outside, eliminate standing water if you can. Treat your clothes with insect repellent. DEET, D-E-E-T, is the most common insect repellent available. You'll find it on the label of almost any insect repellent that you find. Spray it on your clothes. Spray it on you. The only patient that can't have that is a baby younger than 2 months. 2 months of age is the limit for DEET, a very effective insect repellent. Babies need to sleep under mosquito netting. That's really the only way to protect them against from mosquito bites. Also, lastly, protect yourself from sexual transmission of Zika by using condoms or not having sex during the infection period, which is about 7 days. While you're sick, around 7 days is the time that you are infectious. Again, a mosquito that bites you who has the Zika virus during this 7-day period will get the virus and carry it on to the next person. So protecting yourself from mosquito bites, number one, if you travel to one of the areas known to be hot for Zika, and then protecting yourself from mosquito bites when you return is the responsible thing to do. It's been written that to protect yourself for about 3 weeks after travel to one of the areas in the first slide, in the purple section on that first slide. For about 3 weeks after you come back would be good to protect yourself against from mosquito bites. So a pandemic is the catastrophic risk to an organization. On the left-hand side of this page is the World Health Organization (WHO) pandemic phases. They'll put things in kind of grades. On the right-hand side of the page is the Firestorm method of breaking down the pandemic. I'll get to that in a minute, but what you really have is a pre-pandemic phase where the virus is known, is discovered, but it is not, there is not much or any human transmission yet. Once human transmission begins to happen, then it escalates. It escalates through the end, and in the historic pandemics that we've had, it escalated until, number one, everybody with the disease died, or number two, those that did not get the disease developed immunity on their own to the disease. On the right-hand side of the page are the Firestorm stages. Our plans tend to break down the pandemic phase into smaller, more manageable states. And the secret to a communicable illness plan is knowing where you are at any one time. A good communicable illness plan ought to have hard and fast triggers as to at what point you advance to the next stage. You could sit at your desk and just think about it and get up today and say, hey, well, we'll move up to the next stage. But it's far better to have hard and fast monitoring where you know when you are approaching trouble and advancing to the next stage. I would argue that we are, depending on the area of the country that you are either in the green or the yellow stage at this time with Zika. The green stage on the right-hand side of the page is the guarded stage. So we do have sustained human-to-human transmission. However, depending on where you are in the country, it may not represent any problem to your organization at this time. We do know that it's in the news, people are thinking about it, and people are worried about it, but you are not seeing it in your neighborhood at this time. So it is something for you to pay attention to and be aware of, and I would suggest begin talking about with your employees, begin educating. The next stage, the elevated stage, which is what we're seeing in some parts of the country, where we have human-to-human transmission and it is occurring geographically close to your location. So it is in your neighborhood. Many of your employees may not be sick yet at this time. Many of them may not be calling out yet at this time, but it is in your neighborhood and it is around the corner. Effective communication can also be done here, again, more effective, early and often than later. In the red stage, we have you're in trouble at this time. If you've not done anything by this time, you're in trouble. This is affecting your company at this time. Your employees are calling out. They're not able to come to work. So this is now a problem, a crisis for you. So I just want to apologize for this really busy slide. I want to make one simple point from this slide, and it is simply that the complexity of a good communicable illness plan, there are many, many things to consider. A good communicable illness plan will have a good policy statement. In the next slide, I'm going to talk about some ideas for things that you might include in a policy statement. A good communicable illness plan will have monitoring and escalation plans so that you know where you are and where you're going and what you're going to do if you want to stop going there. A good communicable illness plan will have message maps and communication to all stakeholder groups, and these will be written well in advance. Your educational material will be in the bank, in the file, and you break it out when you need it. Who are all of your stakeholder groups? You will have employees, you'll have customers, you'll have board members. There are everybody has different stakeholder groups, but message maps and communication to each of those stakeholder groups is really important, and earlier the better. A good communicable illness plan might talk about telework or telecommuting. Is it possible to work from home? Perhaps parts of this can be done depending on the organization. Perhaps not, but practicing that telework before you turn it on is important. I'm sure everybody's taken their laptop home from work for the first time, plugged it in at home, and not had access to 10 of the things that you need to do your job. Practice before you implement. Things don't run smoothly as they are written on paper, generally. Policy statements. It is advisable to have a policy statement that says something to the effect of, you are here to protect employees and maintain a safe workplace and environment. We want to reduce the spread of an infection. We want to ensure that if you have the infection, that we can treat you. We want to make sure that our policies, our benefits, our leave of absence parts of this policy are good, well-written, and educated. This communicable illness policy should be presented as a benefit to both the organization and to employees. Again, we are here to keep people safe and keep them productive at work. We want to minimize disruption of normal work practices. Things that you should think about in a communicable illness plan. Perhaps cleaning. Have you educated your staffs with cleaning procedures? Perhaps you have introduced a new agent by which things are cleaned. That might be presented as a employee benefit. Look what we're doing to help help everybody stay here and stay healthy? Have you thought about hand wash stations throughout your workplace? These are standing things with a dispenser of a foam or gelatinous product. Squeeze the trigger, put some goop on your hands, and rub your hands together. Presented as a way to help keep your employees healthy, as the ongoing education for your employees and what you're doing on their behalf. Have you thought about how you're going to communicate to everybody? Do you have a mechanism of communicating directly to all of your stakeholder groups? Do you have a database built with all of your employees' contact information, your customers' contact information? Each of your stakeholder groups, do you have a method of reaching them all individually and specifically? It's far better to be able to communicate on your own than it is to try to hold a press conference. I would suggest communicating in as many ways as is possible. Letters in a paycheck. The document that will be a part of this brief is an example of that. Fold it up and put it in the paycheck envelope. Email, social media notifications. Put it on your website. Signs posted throughout the organization, bulletin boards, speaking about communicable illness at employee meetings. Any and all methods of reaching people can be used. Have you analyzed your time off with pay and without pay? Do you have a are you able to take care of people who get sick? Screening for travel. You can't really stop people from traveling. During the Ebola scare just a few years ago, some hospitals that I worked with established policies with a waiting period to return to work. So it was put out and published that if you traveled to one of these, in that case, 4 countries in West Africa where Ebola was prevalent, if you went to one of those countries, you had a waiting period before you could return to work. We didn't want you to bring the Ebola virus back to the patients in the hospital who we were caring for. So all of these things can be considered in a communicable illness plan. Firestorm has an audit available. So this is my second really busy slide, and again, we won't hit all the points here, but a very detailed checklist of all the things that can be considered in the development of your plans. For manufacturers, do your vendors and suppliers have good communicable illness plans? You might have one of your own in your plant, but if a key part or key supply, critical supply, comes from someone else and they do not have a good communicable illness plan, are you going to be faced with a supply chain problem? All of these things are auditable, and with the right framework and kind of checklist can be gone through in a very detailed fashion. Blair will be happy to go over this with anyone that is interested. We are winding to the end here. Firestorm follows a Predict, Plan, Perform methodology. There will be a brief available in a few days at this link. There is also currently a brief available at this link. It is firestorm.com ZIKA 2016. Did a virtual exercise last month on June 14th. This is a very well-written document. It's rich with information, and the price is free, so you can't beat the price. that is all I have. Joe, thank the New Jersey Manufacturers Extension Program. And do you have any closing comments?
Yes, I'd like to just remind everyone that we do have a no-cost assessment that is available in conjunction with Firestorm. That's available to manufacturers in the state of New Jersey to review the risks that are out there and how their company would fare. So they can get that through NJMEP.org or through Firestorm, and you can come out and do the assessment.
Blair, anything to add?
Yeah, a couple of points. Ken, I didn't want to interrupt you while you were talking because it was a lot of really interesting information and cleared up some ambiguities for me personally. I hope the people on the phone also feel the same way. But I just want to mention a lot of the clients that we deal with from the manufacturing arena in New Jersey tend to be smaller accounts. There are some obviously large ones, but a majority are very small. And one of the things that I wanted to sort of stress is the fact that, you know, when you talk about communicable illness and you talk about a prolonged illness in a community or a region, that it's not that we're not talking about Armageddon here. We're just talking about the fact that there's a large number of people that are ill, are unable to come to work, afraid to come to work, and there's a ripple effect through the environment in that children get sick, so people have to stay home with children, and parents get ill, and neighbors get ill, and what happens, even if your employees aren't ill, they're helping other families. They're worrying about their families. So sometimes the ripple effect through your business can be very dramatic, and one of the things to think about is if I'm having my people out, how do I cross-train my people? How do I keep my business going? And again, Ken showed the plan. The plan anticipates not only how do I prevent this, but what do I do if it starts to happen? If one of my key people is gone and I can't run a machine, or one of my processes doesn't work because 2 or 3 of my people are out, you have to start thinking about how do I protect myself against that, and how can I keep my business running? What relationships do I have with my customers that I can go and maybe delay orders or slow down shipments, or things of that nature, where you step back and say, now that I've worked with my employees to help prevent it happening, if it does happen, then how can I continue to keep my process flowing forward? And through cross-training, through working other shifts, you know, there's a lot of good ideas, and again, that's what we work through with the MEP and bringing that skill set together to say, hey, let's look at some of the alternatives. So part of any plan includes those things as well, and I think that you know, that was something that I wanted to make sure it came out. And again, as Joe mentioned, doing an assessment for anyone, we have these assessments that we do free of charge. Very detailed report, talks about business continuity, and we can center on communicable illness as well if that's a key area, and gives you kind of a state of where you are and a little bit of a benchmark of what you have in place, and some ideas on how to move forward. So again, Ken, thank you very much for all that great data. Appreciate it. Bill, any other last comments?
Thank you all for joining us today. We'll look forward to having you with us at our next webinar next month. You can contact us at firestorm.com or webinars@firestorm.com, or you can contact K. Mercer or B. Neville at Firestorm. Thank you once again, and this will conclude our webinar for today.
Great. Thanks, everyone.
Thank you.
Thanks, Ken.